their place. Good afternoon. My name is Bob Black. I'm the chair of the Department of International Health, and I'd like to welcome all of you to the events today. We are here today to celebrate the life and work of Professor Carl Taylor. The program includes comments from professional colleagues, from his family and friends, and certainly former students. And we all have much to contribute to this, so I'm very pleased to see so many of Carl's colleagues here today. I'd like to provide just a very brief chronology of Carl's exceptional life, because many of the speakers will provide rich details, but I'd like to put it in a little bit of context. So I'd like to also call your attention to the photographs on the Wall of Wonder, the large screen projected outside. Lovely photographs, very interesting story of Carl's life beginning in India. And one final thing before I forget it, before I get into the chronology, please turn off your cell phones or turn them on to vibrate or turn them on to something that doesn't make noise for all of us. So Carl was born in the foothills of the Indian Himalayas. He was one of 5 children of medical missionaries. His parents, both doctors, would serve there for 57 years. There are many interesting pictures from that time, I would say, and I found them fascinating. Skipping much of his childhood in India, Carl finished medical school at Harvard and an internship and residency in Panama during World War II. There he met his future wife, Mary, and was married in Panama in 1943. Carl returned to India in 1947 and to direct the Fatehgarh Presbyterian Hospital. And while he was in India in 1949, he was the expedition doctor on an expedition, an ornithologic expedition, but it was a public health survey as well in Nepal, one of the first external groups to come into that closed country up to that point. He subsequently returned to Harvard, did an MPH, did a Doctor of Public Health, and in his doctoral research did some really seminal work on the synergy between infectious disease and nutrition. We actually had a symposium here last year when he and Nevin Scrimshaw did a wonderful part of the program talking about the early days related to that research. He subsequently, then in the early 1950s, went to India to establish the Department of Preventive Medicine at Ludhiana Christian Medical College in the Punjab of India, and in 1960 became the director of the Naringwal Rural Health Research Project, about which I think we'll hear more from some of our speakers today. So Carl joined our school as the first chair of the Department of International Health. In fact, he established, I think, truly the field of international health as an academic discipline. During his more than 23 years in the department as the chair, he developed models for community-based primary health care in much of his international work, and as many of you know, helped write the 1978 Declaration of Alma-Ata on primary health care with the World Health Organization. He also developed, I think, the premier training program in international health, and this is something that we've tried to carry on in his tradition. And there are many students from this period who have not only benefited from his mentorship, but have in their own right gone on to very important careers in international health. In 1984, Carl retired from this position and moved on to China to become the representative for UNICEF and served there for several years. So at the time that I came into the department, 1985, Carl had already moved on to China. Bill Reinke was then acting chair of the department, and I knew from Carl's reputation, not having worked with him directly, I had some very large shoes to fill. And I've been here ever since trying to do that. I would say then after returning from China Carl, fortunately for us, came back to our department to a very active role. He had other interests and activities as well, but his contributions to the department were quite important. And his passion for primary health care, for the empowerment of women and community programs, really continued during the time after he came back from China. And actually, in 2006 was it, when he went to Afghanistan? In any case, he was 88 years old. He moved to Afghanistan for 2 years to run a community-based program in healthcare, and continued that, and then came back to the department. His passion for teaching also did not diminish, and in fact, he came in to teach, although ill. He came in to teach his course in primary health care 1 week before he died. So during the program today, we're going to hear many more details and personal stories from those who've worked very closely with Carl. So I'm only giving a very brief chronology so you'll know a bit of the facts, but I can't possibly do justice to it, but I hope our speakers will. So I would first ask our Dean Emeritus, Al Sommer, to come to the podium and speak.
So first, let me say that for those of you who don't know me, I'm Al Sommer. I once was a dean. And our present dean, Mike Clagg, who really was sorry that he couldn't be here today because of a prior commitment, asked me to convey his best wishes and to be remembered on this important occasion. When I was working with Henry and Ricky and thinking about this day, I said, this is not a memorial, this is a celebration. But somehow I think what I wrote is more like a memorial, so please bear with me. I'm going to be very brief because the others who follow me are going to be much more loquacious than I am. And they have all the right to be because they worked much more closely. So these are my thoughts about Carl. So Carl Taylor was a quiet giant who lived with dignity, humility, and grace. He believed in the ultimate goodness of all humankind and its ability to do the right thing, most of the time. We all know the basic, if extraordinary, plot line of his life, as Bob has just so eloquently described it. Born to missionary parents and raised in the foothills of the Himalayas, where, as I recall, his son Daniel has assured us he could walk silently through the jungle. He returned to the U.S. for college and subsequently graduated from Harvard Schools of Medicine and Public Health. Returning regularly to the developing world, he immersed himself in his lifelong struggle to bring health through local community involvement and empowerment to the poorest communities in the world. In the course of this work, he initiated the prototypical community-based health research program at Naringwal, India, which I'm sure we will hear a good deal more about this afternoon, to prove to the world that simple local measures could dramatically improve the health of women and children. This proved the launching pad for educating others who would follow in his footsteps. The simple expediency for achieving this impact was the founding of the first academic department of international health here at our school nearly 50 years ago. We have all our own very personal memories of Carl, all of which amaze. I'd like to share a few of mine. Whenever I visit Nepal, which a while back was almost annually, I could never help but recall stories of Carl's first visit in 1949, when he literally walked in from India and up, and I'm stressing up, the Kali Gandaki Gorge into the Himalayas, conducting the first public health survey of what until then had been a hermetically closed kingdom, long sealed from contact with the outside world. Not uncharacteristically, he performed surgery, literally with a penknife, on villages at the dangerous cusp of death as he marched along. Several years ago, Jill and I, then still aged only 55, decided to trek the Kali Gandaki. But we flew halfway up, walked a bit higher, and then strolled down. Subsequently, Carl, then aged 80, decided to celebrate his birthday by repeating his original trek, and he again walked straight up from the bottom of the valley, taking along his children and grandchildren, each of whom he assigned a productive task, from cataloging the local flora and fauna to village cooking techniques. I don't believe he did any surgery on that particular occasion. I first encountered Carl when I was a student here at the school in 1972, shortly after returning from 2.5 years in what had been East Pakistan and had become Bangladesh, where I had learned, or thought that I had learned, that rural communities would never receive regular care from physicians because physicians didn't care to live and work in rural communities. Carl, who believed in the infinite goodness of nearly everyone, particularly physicians, argued that they would, if only they would receive the medicines and equipment they needed to be effective. The single most startling moment Carl gave me was many years later, when I was this school's new dean, and the U.S. was on the verge of the first Gulf War. I received a call late one Saturday night from Carl, who said he just wanted me to know that he would be leaving for Iraq the next day. Iraq, I said incredulously. Carl, we are going to bomb Iraq within the next few days. I know, said Carl, but someone has to be there to bring attention to the plight of Iraq's children. He went, we bombed, but fortunately Carl had left on the last UN flight out of the country. It was certainly no surprise to me when a few years ago he went off, as Bob has mentioned, to work in rural Afghanistan. I miss Carl, but I do not mourn him. He and his beloved Mary lived long, productive, and rewarding lives. They touched the souls of everyone they met. Carl made a quiet but determined difference. He had a giant's impact.
Thank you. Next, I would ask Tim Baker to come up. Tim, of course, is a professor in our department. He was actually here before Carl, was the acting director of the then Division of International Health in the school. And in fact, just last year, we celebrated Tim's first 50 years of contribution to the department. Tim?
There are 5 vignettes of Carl Taylor's early years at Hopkins that should be of interest to us. His first contact with Hopkins, the health management program in 4 countries, the International Health Planners course, Carl's saving the department from eradication, Carl's role in establishing the Institute for International Programs. Carl's first contact was in 1961, when an emissary from Hopkins went to Harvard to try and recruit him to head the recently established and funded program in international health. At that time, as Bob Black has mentioned, and as Al mentioned, Carl had established research and service programs in Narangwal in the Punjab. When Carl had decided to leave Harvard and come to Hopkins, Dean Jack Snyder came into Carl's room and said, "Carl, I want you to understand that the Punjab belongs to Harvard." Fortunately, as Henry Perry will tell us in his presentation, Carl ignored the dean's admonition. When Carl first came to Hopkins on a full-time basis, there was funding from USAID for health manpower studies in Taiwan, Peru, Nigeria, and Turkey. Carl visited and consulted on all of these projects and was a senior author of the monograph on Turkey. The Senior Health Planners program was initiated by Carl in 1963 at the request of WHO and USAID and Pan American Health Organization. As I read over the historic documents about this course, I realized that in the words of Vice President Joe Biden, this was a big deal. There were over 400 graduates from this program coming from more than 80 countries around the world. There was the Director General and 2 Deputy Directors General from the Government of India Ministry of Health, Director General of the European region of WHO, Director of the UN Population Program, 3 Directors General from Indonesia over the course of the years of the program, Director of Health in the Inter-American Bank. A traditional part of the Health Planners program was a picnic, a Saturday picnic at Carl Taylor's house. The afternoon started with a baseball game on a nearby grassy hilltop. It was so steep that the right fielder could not see the batter and had to guess when the ball was coming his way. This was followed by a delicious meal prepared by Carl's wife, Mary, who fed almost 50 planners and faculty. Carl thought that she should receive a planner's certificate for planning this, and I would certainly agree. The planners course also led to the publication of the health planning textbook, edited by Dr. Reinke, and with several chapters by Carl Taylor. The book went through 7 printings and 2 editions. In 1979, the Department of Pathobiology had been eradicated. There were 3 departments of biochemistry in the university at that time, which some considered to be quite redundant. The Department of International Health was also slated for eradication. Just before the advisory board meeting to determine the fate of the department, Carl went to Larry Grossman, chairman of biochemistry, and he said, "Larry, you're next." The following day, the advisory board met, and International Health was kept by 1 vote, Larry Grossman's. And if Carl had not been a master strategist, we wouldn't be here today. Since Carl's DRPH dissertation was on nutrition, it seems appropriate that we should conclude with a discussion of the nutritive value of pork. In 1984, Carl returned from a meeting with Congressman Clarence Long. Carl had provided some useful information to him and reported that Congressman Long said, "What can I do for you at Hopkins?" Carl said, "On short notice, I didn't know what to tell him." After discussion, Carl called him back and asked him to do the same thing that Senator Sparkman had done for the University of Alabama School of Public Health, i.e. to provide some massive funding. And Carl did, and Congressman Long did, and made a major earmark that was used to establish the Institute for International Programs here at Hopkins. An interesting sidelight, to continue the porcine analogy, Dean D.A. Henderson saved our bacon. Peter McPherson, the head of AID, called him mad as hell because the earmark had been taken out of his budget in USAID. DA quite wisely said, "Peter, you were an academic administrator. You know how hard it is to keep your faculty in line. But you know, it is a very good project." So International Health continued through the following years with USAID funding. These 5 vignettes are only a small sample of Carl's multifaceted early years at Hopkins, years that built the foundation which Bob Black is still building the department.
Certainly were some interesting times. Thank you, Tim. I'm pleased to introduce our next speaker, Nick Cunningham, who is Professor Emeritus of Clinical Pediatrics of Columbia University. Nick is one of the early doctoral graduates of our department. He tells me that he thinks he is still the doctoral student who was here the longest as a student, although we have to check our records. I'm not sure 10 years is still the current record, but you're way up there. Thank you for coming today.
Actually, you left out that I'm emeritus in public health as well as pediatrics, clinical public health. What I'd like to talk about is, I consider Carl the founding father of international health in this country. And as the founding father, he was like Abraham Lincoln. His arms and breadth and reach were extreme. I never took his course. I never really worked that closely with him, though when I was doing my data gathering in Nigeria, he did come. And as was mentioned, Hopkins had a visiting professor, Bob Wright, whom Carl had put in Lagos to start preventive medicine, community health, and family planning there. So I'm going to speak from the point of view of all the people that Carl has influenced over the years via distance learning, if I can put it that way. People who, like me, didn't work with him, didn't take his course, but consider him the inspiration for our careers. Now, his work with John Gordon on nutrition and infection, he was prescient. He realized that nutrition was not being adequately considered, and he has continued to preach the importance of integration in all kinds of ways, including in nutrition and infection. When I went to Ethiopia 2 or 3 years ago, I got government statistics that showed that 66% of all 0 to 5 children in Ethiopia were malnourished, and 16.5% of them were below 60% of standard weight for age, which meant they were going to die within 3 or 4 months. The granaries, as you rove around Ethiopia, are still full of soybeans, wheat, things waiting for the next famine. And the famine is there. And Carl recognized that before he ever came to Hopkins and wrote the seminal work on the synergy between infection. When we say children die of measles, they don't die of measles. They die of measles and malnutrition. So that was such a major piece of work. Then he learned that the way we learn about public health is in the field, from populations. And at Naringwal, he defined the target population. I hope that in teaching public health, we always tell our students that a defined target population gives you the denominator. It's essential to understanding public health. And he recognized that. He stayed there from 60 to 70, a long time, 15 years. He had been at Ludhiana, as was mentioned, and founded the Department of Preventive Medicine there. And then he came back and did this work. And that work emphasized, there were so many lessons that were learned at Naringwal, and cohorts of people. When I visited Naringwal, Coke McCord was there, and I met his 12 or 14-year-old daughter, who is now a pediatrician in the practice that I started at Columbia. And there was a fellow named Barnes there from England, and he was an obstetrician. And I had tea with him, and at a certain point a bell rang, and he said, "That's one of my pigeons." And he had a little little platform on the roof of his house, and a carrier pigeon, which had been left earlier in a village where a woman was in labor, had just landed and told him they had to get out there and do something about it. They were doing so many innovative. I don't think that innovation survived, actually. And if it did, we would have to tell you to turn off your pigeons before. But in any case, he integrated maternal and child health, family planning, nutrition, child care. It was together there. And huge learning took place. Now, one of the things, it wasn't so long after that, I mean, it was maybe 3 or 4 years after that, that he engineered Alma Ata and probably wrote a lot of the Declaration of Alma Ata. I consider, if Carl is the founding father of international health, for me, in international health, the Declaration of Alma Ata is our Constitution. And we need to keep going back to it and recognizing how important it was. And I try to do that in my teaching. One of the other things that he brought out at Alma Ata, that Alma Ata established, were the importance of ownership, self-help, which led directly to the proliferation of work with community health workers. I mean, at one point, Carl said 80 to 90% of health care in the developing world comes out of the mouths of community health workers. Sustainability. I quote, this is one of the things that Carl said, I think, at Alma Ata. He said, "I was amazed at the speed of the collapse of the barefoot doctor model we had so admired." And I think what he realized from that laid the seed in his mind for his recognition that if you don't work with the money, power people, when they change their mind or they move on to something else, you're out of, you know. I saw this in New York City with the neighborhood health centers. One of the features of President Johnson's war on poverty were neighborhood health centers. There was a fantastic one at Montefiore called Martin Luther King. It had all the brightest and best young doctors and nurse practitioners. They were doing research, publishing. It was incredible. In Manhattan, near where I now work, is the Ryan Health Center, a small, much less ambitious, and probably much less effective neighborhood health center. When cut time came, it's like diabetes. You know, you lose a toe and your foot. They just started cutting Martin Luther King. And because it was basically a paternalistic thing, a creature of Montefiore, it just disappeared. I mean, it's still their name, but it's nothing. Ryan is still going strong. Carl learned at Naringwal that if the community owns it, if they help build it, they'll fight for it. And it's going to survive. And so that, I think, he tried to bring out in the Declaration of Alma Ata. So we all learned. I mean, he learned, we all learned. Another thing that he said at that time, or I guess after Warren and Walsh, after the Rockefeller started saying, well, you know, this is very nice, but it's kind of visionary. We can't really do all that. Let's do selective primary health care. Carl said, yeah, they're picking the low-hanging fruit. And I don't say he was talking about the smallpox eradication program, but certainly things like immunizations that had done to people without learning taking place, without communication, without understanding of the whole implication. I think he understood very early on that we're going to have to address behavioral change as well as, and to do that, you have to be in contact, in communication with the community. He used to have long arguments with Jim Grant when he was at UNICEF, and I guess even before. And sometimes Jim Grant would say, "What would Dad say now?" Well, I happen to be a great admirer of John Grant, whose book I refer to a lot. And Carl, I think also, is in the direct line of missionaries. Missionary health, people who hang around long enough to learn the local language, stay. They say they did some great things, they did some bad things, but they stayed. And Carl had that staying ability. And John Grant had such a long career in so many countries. It was amazing. Well, John Grant, I think that Carl used to ask Jim Grant, what would your father say? And one of the things that John Grant said was, the village itself has been taken as a starting point for observing village improvement, rather than working from the center down. Now, Carl's students, Mabel and Raj Arole, Raj is still alive, came to Hopkins, and they put into practice Carl's ideas. They learned, they went back to Jomkhed, and it's still, I believe, our best example of sustainable and locally spreading, rather than upscaling, integrated primary care. An amazing project. So, well, they got it directly from Carl. So that wasn't exactly distance learning, but they took it back and applied it, and it's hugely impressive. In Just and Lasting Change, Carl and his son put together what he'd learned over a lifetime. I find it kind of tough going to read it. It's got wonderful chapters. There's a chapter on the Adirondack State Park, which is a gem. It's about health, but it's about how the messy democratic way that you get things done. And he concluded in that book with his son, the principles of sustainability are community ownership, build from the bottom, professional oversight, so you collect data, you do it scientifically, you don't just fly off in all directions, and you keep balancing it, and money, power, support. And the point that he made there was, which we all learned from, was these things, it's a three-legged stool, but it has to be constantly rebalanced, because each of those constituencies thinks that they can do it alone by themselves. And though the other two have to gang up and prevent anyone from taking over. So this idea of a constantly rebalancing tripartite partnership is a brilliant concept. And we've all learned from that. The seed scale method of getting there, I find it's not the most digestible thing. I'm sure it's great, and I have enough faith in Carl that I'm going to take it on faith, but I don't quite understand it yet. Maybe the next edition will clear that up, Henry. Anyway, what made Carl such an inspired teacher? Well, I'm going to go through this quickly because I'm running out of time. First of all, he was open, always open, willing to learn. And when he invited Olukoya Ransom Kuti and Ekoma from Nigeria to come and be visiting professors at Hopkins, the idea that we could learn something from the people in the countries was very important, and that has continued. We now have bilateral arrangements with many of these places. He was optimistically enthusiastic. Bob Parker told me that in Naringwal he was known as the Big E for enthusiasm, or for his middle initial. He always left time for questions, and then ran over, went even farther than that, just wouldn't leave until every question was answered. He had a calm patience. Maybe that was from his missionary heritage. I mean, spending 15 years at Naringwal trying to learn all the time, that is very remarkable. Margaret Catley Carlson from the Pop Council says that in public health, we realize problems take 20 years to resolve, or a generation or something. Yet we plan for about 10, we implement in 2, and we budget for 1. Carl didn't do that. He had the long view. He not only had the reach, he had the vision to see out there and look down the road. He was civilized. When Bob Parker came back from Naringwal after 5 years and had a young family, Carl urged him to put his family first and got him a part-time job. So he supported his own. He understood the needs of the people around him. He was consistently positive. Henry Perry says he wasted little time on disappointments and recriminations. I mean, I would have thought he would have gotten very upset at certain points with the way things were going. He had that sort of, I don't know, it's going to come out in the end, it seemed like he was saying. He had a huge appreciation of women. Mary, of course, but all women, and saw them as the way to international health. Bob Parker says that in Afghanistan, to get them talking, which was very difficult behind their burqas and stuff, he started asking them about their pregnancies. And of course, they were willing to talk about that, and that opened the door. So he knew how to communicate, listen, and that's essential. And he was realistic. He was down to earth. I mean, it was shoe leather epidemiology, I think. I don't know whether he coined that term, but he certainly believed in going out in the community and learning. Now, one of the things he said, he certainly didn't want to get into arguments about vertical versus horizontal and all that, and I don't either, but he said, vertical programs eventually have to be integrated with sustainable health systems. And isn't that the way it is? We have to do vertical programs. We're pushed to do them. In Haiti, wherever a disaster occurs, we're going to do something. And we're going to do what we know how to do. But in the long run, we've got to look beyond that and build up, as the Arolés have done. I think that was a very realistic in the sense of not just what we need to do right now, but what's down the road, what's going to happen. One little story. I'm a child abuse maven. I mean, I don't abuse children, but I protect children. And I hired a right to life, not a right to life, a life, what do they call it? Life, what do they call it? The people who take care of the children who are waiting to be seen in the clinic and stuff. Child life, yeah. A child life person came to head up the therapeutic nursery that I had started at Columbia Presbyterian. She was a very energetic Jewish girl from New York City, and she wanted to go to India and trek. And she joined the Woodland Institute and found herself on a trek in Nepal with Carl Taylor and a whole bunch of medical students. The medical students were wild men, and they were out marching ahead, always getting ahead of the Sherpas and whatnot. And she, being kind of a soft New Yorker, you might say, was in the rear. And Carl, who was then over 70, maybe 75, I don't know what he was, would stay with her, and they had a lot of time to talk. And she got to know him. He hiccuped for 7 days. He'd just come from China. He had, what do they call that? There's some kind of dry hacking cough you get in China. I don't know what it was. And he hiccuped day and night for 7 days. But it didn't stop him. He was trekking out there all, with the others and staying with her. Well, one of the students would get so far ahead that he was worried. So he devised a plan. And he said, look, isn't that an interesting valley up there? And he'd send them off on side trips. And then they could come and catch up. But he was unsuccessful. And one of them, crossing a glacier on a very narrow, I don't know, a log or something or other, fell off and knocked himself out. And he was unconscious for days. They were 3 days from the nearest cell phone. And the question was, what are we going to do with this guy? And he was completely out. And they had to carry him out. It took 2.5 days for them to carry him out. Carl, with his understanding from childhood of the Himalayas and of hypothermia, was able to keep that, with all these young, brilliant med students there, he was the one who held the whole thing together, and that man survived, and eventually was flown out, had a huge subdural, but survived and lived after a horrific accident. He was a doctor, a teacher, a leader, seminal, and an absolute inspiration for all of us working in international primary health care for children and mothers who most need it. Thank you.
Thank you. Next, I'd like to ask Henry Perry to come up. Henry is now a faculty member here in our department, but until recently, he was the Carl Taylor Professor for Equity and Empowerment at Future Generations, which is an organization, an NGO, founded by Daniel Taylor-Ide, Carl's son, an organization to which Carl devoted a lot of his time and attention and contributed greatly to in his later years.
Thank you, Bob, and good afternoon, everyone. I didn't realize it, but when I was offered the position that Bob mentioned, I didn't realize I was marrying into the family, but in fact I was. Future Generations was started both by Carl and Carl's son Daniel, and I spent 6 years working with them in a lot of interesting and exciting activities. This is a special honor for me to be here today and to speak on behalf of so many of us who have had the privilege of working with Carl and being his students. As I was struggling to think about what I could say today, there were two things that came to me. The first one is that Abhay Bang, that I will speak more about in just a minute, his His words when Carl Taylor died were, "A banyan tree has fallen." And that has special significance for people from India, and there are people here who understand that much more than I do. But a banyan tree has an extensive root work and extensive shade. It's an enormous tree. And someone was even telling me just a few minutes ago before this started that a banyan tree is such that if the center trunk actually collapses, the rest of the tree will stand up, and it has enormous roots. And it's a very revered tree within India. So I think that symbolism of Carl's passing is very appropriate, and it has a rich meaning that I didn't realize the first time I read it. Also, as I struggled to start my presentation today, and what I would say in such a short time, the word extraordinary came to me. Carl had an extraordinary background and upbringing, and I'll mention this in just a minute. But he also had extraordinary gifts: intellect, charisma, faith, and as we've heard as well, energy. He worked extraordinarily hard, and I spent enough time with him to see this even in his last years. Not only at his professional activities, but as a father, earlier as a husband before Mary died, and as a grandfather as well, and I had a chance to see that, having married into the family, as I mentioned. He lived an extraordinarily long professional life. He started his international health career, legend has it he started at 5 years of age. Henry Taylor said it wasn't quite that early, but that's the legend. So his career expanded 87 years, extraordinary. But the word extraordinary does not stop there. I think Tim Baker and Dean Stebbins showed extraordinary foresight in recruiting Carl as the first chairman of the Department of International Health here at Hopkins. And Carl brought extraordinary recognition to Johns Hopkins through his work, and he attracted extraordinary students here to study. And Johns Hopkins was extraordinarily fortunate that Carl found his long-term home here. Even though he did have to, and Daniel Taylor asked me to, who unfortunately couldn't be here today, his son Daniel, he wanted me to be sure to emphasize to you that Carl needed to get out of here, to get back to the village, to breathe some fresh air, and so he very frequently disappeared and got himself rejuvenated again. So, if we could have the first slide. After I wrote this, I realized this term global champion could be thought of in a variety of different ways, but I think of Carl as a global champion for community health and primary health care in many different ways. As we've heard, Carl's parents were both medical missionaries. They spent a very long time working in the villages in India. The person on the left is Carl's father, and I thought the person on the right was also Carl's father, but Henry Taylor told me yesterday that was his mother. And she was taking care of the women, and he was taking care of the men, of course. But they started out in a hospital, and they realized that the people who needed care weren't getting to the hospital, so they left the hospital and went out to the villages and spent many, many years working directly with the people during the daytime and at night, involved in education and sharing their faith. This is what Carl's life was like growing up. This is one of the camps that they stayed in. They went by ox cart from village to village when Carl was very young. The picture on the bottom left is Carl on the right and his older brother John. And that thing that looks like a basketball is actually an armadillo, a plated armadillo that was his toy. And they have put a nail in the back of that thing with a string on it to make it into a leash. So then this was Carl's mother sitting in a chair on the right, as you see. And then talking about a missionary family going local, I think this is a great example of it. This is Carl on the far left in the black turban with the rest of his family. Bob Black shared with us about Carl's going to Harvard Medical School, studying tropical diseases in Panama, and then coming back to Harvard to to northern India, right in the middle of partition, a very tragic time in history, as we all know, but there he is in full force. I wanted to emphasize the influence of John Gordon, and in my view, from what I know about Carl, I think John Gordon was a seminal figure for Carl. John was a professor of epidemiology at Harvard, but he had extensive experience working out in the field. He was a close friend of John Grant, as Nick mentioned earlier, and Carl always considered John Grant to be the father of primary health care, but through that exposure, I think Carl got a real sense of epidemiology and the importance of a defined population as a denominator and as a conceptual framework for doing public health work. This is one of my favorite photographs too. This is Carl in shorts, you see in the middle, standing next to the tall man who I was very close to as well, John Wyan, in the Kana study, which preceded the Naringwal study. Naringwal and Kana were both in the very northern part of India here, if some of you may not have known exactly where Naringwal was. But many people, including Tim Baker, consider the Naringwal project to be perhaps one of the crowning achievements of Carl's career when we look at it in big perspective, and I think historically it will turn out to be an important contribution too. And I want to take just a moment to share a little bit of the richness of what came out of the Naringwal study and some of the procedures that were used in it. It was one of the first projects in the world to demonstrate that community-based services provided by village-level workers can reduce child mortality, improve nutrition, and reduce fertility. It was one of the first field applications of the simple diagnostic tool for diagnosis of the leading cause of under 5 mortality in the world, childhood pneumonia, by having community health workers identify a syndrome that included cough, fever, and labored respirations. Naringwal also provided one of the first demonstrations of the effectiveness of the community-based administration of antibiotics by non-physicians in reducing mortality from childhood pneumonia. The Naringwal project was one of the earliest examples of participatory community-based research, and village leaders and village residents were involved as partners in planning, implementation, and monitoring of the effects of the project and its progress. It clearly demonstrated the greater cost effectiveness achieved when maternal and child health and nutrition and family planning services are integrated. Professor Bob Parker, who worked for many years with Carl as a Department of International Health faculty member at Naringwal, recalls the following. In spite of the many ups and downs of the research projects we were involved with, Carl was always optimistic and full of ideas, and as Nick said, they referred to him as the Big E. The Naringwal project was also the origin of what at that time was controversial but is now widely accepted, the child survival hypothesis, which stated that mothers will not start having fewer children until they know that the ones they do have are going to survive. Other important observations made in the nutrition study were the following. One-on-one education of mothers was essential for improving practices related to breastfeeding, infant feeding, rehydration, and feeding of sick infants, and was also important for overcoming traditional beliefs about not feeding a child with diarrhea. Weekly home visits were necessary in order to produce a drop in infant mortality. Visits for older children did not need to be as frequent. Delegation of services as far to the periphery as possible improved coverage and effectiveness. Rehabilitation of malnourished children through special feeding programs is best accomplished at home or near the home. Involving lower-level staff and working on improvements in service delivery was important for team building, for motivating the field staff through supportive supervision, and it was important for improving service quality. Combining field experience and surveillance and making appropriate use of the data arising from that surveillance made it possible to improve program functioning over time. Building trust with the community and its members, as Nick mentioned, was essential for developing a quality healthcare program, and having a curative healthcare service was an essential element of building trust. The most important changes made were those in the routine practices in the home. and integrated services were more cost-effective than the various packages provided alone. The degree of community engagement in the program was highly unusual for a research project. Regular meetings were held with community members to obtain their consent for activities, their feedback on current activities, and their participation in ongoing revision and improvement in project activities. All of the project research staff lived in the village, as Nick mentioned again, and this is terribly important. This also facilitated interaction with the community, and of course it focused the research on realistic issues faced in project implementation. The contributions of the lowest level health staff, the family health worker, to the ongoing modifications of the project were also striking. Carl made it clear that the involvement of village people was a critical element in making the project successful, and that engaging them and making adjustments over time would be essential in improving overall health impact of the project. The findings arising from this research are highly relevant to the current debate on health improvement around the world and the achievement of the Millennium Development Goals. The Nearing Wall project had an influence that has gone far beyond the specific value of the research findings. The findings that specific interventions can lead to documented reductions in under 5 mortality provided part of the inspiration and vision for Jim Grant and UNICEF to launch what is now referred to as the first child survival and development revolution, beginning in the mid-1980s. Furthermore, the Nearing Wall project served as a major influence on the field projects in Jamkhed that the Arolis led, and in Gachiroli led by the Bangs, which are now world famous, as well as on the Matlab Maternal and Child Health and Family Planning Program in Bangladesh. The findings from the Nearing Wall project and the personal inspiration and encouragement which Carl provided were major influences on so many projects around the world at that time. As you can see, the Nearing Wall project had a variety of cells. It was an experiment, and a very sophisticated experiment at that time that involved community-based work, and I'll show a few slides of that here. One of the important features of Nearing Wall was that Carl insisted that high-level dignitaries come to Nearing Wall to see exactly what was going on in the field. And so annually, people came and they set up special tents here, as you see, and they had these very distinguished gentlemen from the India government out in the villages visiting people and learning what the project was actually doing. And of course, he had receptions in his home. There's a picture of Carl with the tie on facing us with other visiting dignitaries in Nearing Wall at that time. And the book, there were about 100 publications that came out of this. Many of them were published in Indian medical journals and are not widely known. And a book summarizing all of this was published by the World Bank. We've heard a little bit about Roger Rowley and his wife Maybelle, who is now deceased, and their work in Jamkhed in India. I had the privilege of being with Carl in his last visit to Jamkhed and to watch the reverence and appreciation that the Arolis had, as well as the Bangs, for Carl Taylor was quite an experience for me. I wish I had time to tell you more about the Jamkhed project, but I think, as Nick said, I think the Jamkhed project in so many ways pulls together so many of Carl's ideas and passions that I know that Carl continued to learn from it in his trips back that he made so many times. And the book that the Arolis wrote about Jamkhed, they wrote while they were visiting faculty here back in the 80s. And even though it's not published in the Lancet, this book has been translated in, I think, 7 or 8 or maybe 9 languages by now, and it's read by low-level workers all over the world, as well as very top-level people, too. And I think the influence of this book has been astounding, although we don't have any way of actually measuring that. I think many of us know about the work of Abhay and Ronnie Bang. They have changed the face of global health in many different ways, but perhaps most importantly through their demonstration of the effectiveness of home-based neonatal care and reducing neonatal mortality. And their ideas for their work came directly from the Nearing Wall project and through their relationship with Carl and his support over the years. As we heard, during the 70s, Carl told me that he was going back and forth to Geneva like a yo-yo. Halfdan Mahler became the Director General of the World Health Organization, and he asked Carl if you would help him in this activity that led up to the famous conference of the International Conference on Primary Health Care in 1978 at Alma-Ata. And in the recent obituary that was published in the New York Times, Halfdan Mahler referred to Carl Taylor as the greatest public health professional I have come across. That's quite a tribute from perhaps the greatest Director General of the World Health Organization that we've ever had. But the Declaration of Alma-Ata was a seminal event, as we've already heard, and Carl, being the gentle and very modest and humble person that he was, he never took much credit for it, but I think all of us know that in reality he probably wrote quite a bit of it, and it will be a lasting document that will serve us in future generations as a source of inspiration for our work. Of course, we all know that the momentum that led up to Alma-Ata quickly dissipated as the enthusiasm and support for more selective approaches took over, and this was a great disappointment to Carl. But as we've also heard, Carl kept going. He kept his positive attitude, and one way he did that, after he finished his time, and as Bob Black mentioned, after he finished his tenure here as the chairman of International Health, he went to China as a UNICEF representative. This was a chance to work for Jim Grant, who was John Grant's son, as we've also heard, who was also a close friend of Carl's. But Jim Grant was really leading the policy debate towards more selective approaches, but he allowed Carl to go to China and start something that was very innovative, that is still little known to this day, called the Model Counties Project. And I hope that someday this will be published and given its due credit, but because of political reasons within China, this has never been allowed to be published. But, and there's a long story behind this, but it goes back to Carl happening to know the Director of Maternal and Child Health for the government of China, who happened to be the wife of the President of China. And with all the deconstruction of the communes and the loss of the barefoot doctor and all of the collapse there, that led for an opportunity to create a new approach for strengthening community health for mothers and children in China that became known as the Model Counties Project. And over a course of over 10 years, this scaled up to reach 400 million people and 1/3 of the population of China. And Carl and Bob Parker, his long associate, who would very much like to be here today, worked with Bob on this, and an evaluation published by the Shanghai First School of Public Health showed extraordinary results in this, and we're hoping someday that this will be able to reach the light of day internationally beyond China. Many of China's leaders in maternal and child health are products of having worked in this program, so it had an enormous influence. After Carl came back from China, he spent a lot of time, as Bob mentioned, working with Future Generations, a small NGO that Daniel, his son, you see on the left, started. Carl had a whole nother fabulous career relating to Peru, and I can give a lecture on that, but Carl helped to create a whole new approach towards the management of community health centers run by the government of Peru through many trips down there and talking patiently with the people of Peru about a crisis that had arisen there. We all know of Carl's love of the Himalayas, and through Future Generations, he was able to make many treks into Tibet. And then through that process, they developed a whole cadre of community health workers called PENDABAs that Future Generations has been engaged with, and Stan Becker has been out to. So there's work in Peru and Arunachal Pradesh in India and Afghanistan that Ambrosy Edwards is going to speak of. And we've heard of the book Just and Lasting Change, which is a Bible that many of us know about. We've heard about Seed Scale. And I had the privilege of teaching in the master's program that Future Generations started. And it is a very unique program that has 31 graduates now that's just been accredited, but very experiential, grassroots-oriented kind of work. And then towards the end of Carl's life, he worked with me on this review of the effectiveness of community-based primary health care in improving child health. That's a collaboration with UNICEF, and Bob Black has been engaged with, and we're excited about the future of that. So, I'm going to skip this because I've taken too long and simply go back to what Nick said. I heard Carl himself bring this question up many times towards the end of his life. What would Jim Grant say now? And as it turns out, and here we have Jim Grant and Carl Taylor. And just a few weeks ago, Carl Taylor's last publication came out in The Lancet. And the title of the publication on April the 10th is What Would Jim Grant Say Now? And I'd like to close with this. Our greatest mistake has been to oversimplify the Alma-Ata vision of primary health care. Real social change occurs when officials and people with relevant knowledge and resources come together with communities and join action around mutual priorities. The interplay between comprehensive, horizontal, and selective vertical approaches requires careful blending. It is my conviction that if Jim were here now, he would champion this blending adapted to the local context with the focus on communities to ignite the next child survival and development revolution. Thank you.
Thank you, Henry. And next I'd like to call in Dr. Anbarasi Edward Raj, who is a faculty member in our department and someone who has worked very closely with Carl on projects such as Afghanistan and in his teaching here.
During my MPH program, Ricky Fine directed me to Dr. Taylor and Baker, partly due to their contributions in India, but primarily because I was interested in serving in missions. Like many of you in the audience, after 15 years of frequent exposure, I acquired a very serious disease condition. It's called the Taylor syndrome. And the only cure is found amongst the poor in the communities. But just as I've been a willing victim of his doctrines, I've also been a privileged recipient of his benevolent, gentle humility. He often cautioned me to not approach communities or students with academic arrogance. Rather, he modeled for all of us how to listen and learn and not impose. We started with the case studies course, and as I witnessed the fascinating exchange of concepts and solutions between Bob Lawrence, Bob Parker, and Archie Golden, the story behind the story for sustainable development, I tried to persuade him to offer the course online so a wider community of students could benefit. But he refused, preferring to work with the students in person. When Henry joined the team, he eventually gave in, but only after I created an innovative strategy of simulating student discussions. Always willing to risk something new, he enjoyed recording, thanks to the efforts of the distance education team, Dinesh Taylor, and Dr. Black's support. The music was Dr. Lawrence's choice, by the way.
Hello, this is Carl Taylor.
That's just a short preview. You'd have to register and pay for the tuition. I think the tuition is about... If you really want to save millions at a time, I highly suggest you take the course for grade. As an academic community, we have an obsessive compulsion to quantify the evidence base. On the first day of class on health information systems, which used to be in the East Wing Auditorium, which is now the Sheldon Hall, Dr. Matthew Tabak, in his very meticulous fashion, would neatly unfold a $5 bill from his wallet and quote Edwards Deming, "In God we trust, all others must bring data." The pioneering spirit in Dr. Taylor was always on the quest for exploring the unexplained variance in our traditional metrics and statistical models. Afghanistan was such an experiment to test the seed scale formula for sustainable development. He always accented the positive in all his lectures. So despite the horrific images from CNN, Afghanistan is a beautiful country. This is for Dr. Black, who I've been trying to persuade to visit Afghanistan. This is Bamiyan province, where Dr. Taylor served as country director for future generations. The roads are impassable during winter, but this did not deter Dr. Taylor from working in these communities. Most of the infrastructure was demolished, and education was exclusively for males. This is one of his favorite slides, where a little girl is eagerly looking in from the ruins. The program instituted 400 mosque-based schools for girls in Ghazni. In a culture where women are not permitted to travel without a male escort, he successfully engineered these 4 to 5 day WOW workshops. It's women-only workshops facilitated by female physicians. Pregnancy histories were employed as a participatory methodology to motivate and train the community providers in health and nutrition. Women learned safe delivery practices. To track outcomes, he defined a new type of health cadre, community statisticians, who have the numeracy skills to manage health information and vital event systems. The opportunity for training and learning and sharing together, and even practicing to write with a pencil, was exhilarating for these women. It built self-esteem and empowered them to make decisions. In this school, we often quote Lord Kelvin, "You cannot manage what you cannot measure." But Archie Golden in class often quotes Albert Einstein, "Not everything that can be counted counts, and not everything that counts can be counted." Their enthusiasm translated into improved coverage for TT, for stillbirth attendance use, and reduction of harmful practices for obstructed labor. In a country with one of the highest maternal mortality ratios, this is significant. The economic and environmental dimensions of the model were addressed through the Pagal clubs. These are crazy committees, which are actually village health committees formed by the ex-Mujahideen, who felt they were crazy enough to believe that change is possible in Afghanistan. 150,000 poplar and willow trees were planted in the former opium fields. As the momentum built up, so did the demand for project expansion, instigated by the converts of comprehensive development. Aside from the seed funding from the Management Sciences for Health for operations research, soliciting investors for scale-up became an arduous challenge. For 2 years, we brainstormed ideas during long walks and dinners with Stan Becker and Henry Mosley and everybody else, and his passion for the Afghan communities occupied his every waking hour during his last years. Of the avenues explored, the strategic alliance with the Jhpiego team showed some promise. Here's the deputy director and a newly recruited Afghan obstetrician. Eventually, they facilitated the first national workshop on community-based primary health care, where the Future Generations model was showcased. This picture illustrates the three-way partnership of the academic community, the Minister of Health and policy leaders publicly endorsing the value of the community providers, who are in blue, on national television. Subsequently, a policy meeting was planned to consider the Women's Action Group as a national strategy for community engagement. Since I was the only female present, I strategically placed myself near the door, as Dr. Taylor made a compelling case for women's empowerment in a hall of men and press reporters. After a 4-year crusade, the Women's Action model has been scaled up, but not as he anticipated in Bamiyan. It is now integrated in projects conducted by Jhpiego and other PVOs, the National Anti-Insurgents Program through MSH, and the National Solidarity Program. Recently, while we were at a dinner meeting with Jhpiego, the Afghan obstetrician, who's now the deputy director, pointed to his favorite book in the bookshelf of his living room, The Just and Lasting Change, and said, "Here is hope for Afghanistan." One day before the application deadline, we coaxed him to apply to Hopkins, and he's been accepted into the MPH program for 2011, and we believe he will pursue community efforts in Afghanistan. He was equally passionate about students who listened, debated, and stimulated his ideas. A multicultural JHU mafia surrounds him in 2004. For 3 years, we celebrated his birthdays in Afghanistan, where he enjoyed the discourse of former students. That's Steve Salter in the background in blue, who took his course 20 years ago, and one of the Fulbright scholars who's now with the team at Hopkins. We played phone tag the week before, but never got to saying goodbye, as I left for Afghanistan on February 4th. But as Tim Baker walked me down to his office, I recalled his counsel, which he often used when I was discouraged. Embarassi held in the hollow of God's hands. His passion to bring justice to the disenfranchised was motivated by his deep faith in Christ. The title of his book was inspired from the scripture, which appeared in the pre-edition, "But let justice roll down like waters and righteousness like an ever-flowing stream." I believe the Hopkins community is renowned not just for its scientific achievements and global impact, but the integrity and humility of its distinguished scientists leading change in complex environments. I would like to thank Dr. Black and Ricky Fine and the organizers for this opportunity to celebrate Dr. Taylor. And the fact that both Henry and I selected the same picture shows that there's some association between owning an armadillo pet at 3 years and achievements in public health. Thank you.
So I'd like to thank all of our speakers for the very interesting and moving remembrances of Carl's life. We do have a brief interlude, and we're going to resume at 3:30. So I'd ask all of you to please be back in your seats and ready to start again at 3:30. In the meantime, out in the lobby of the gallery, there is another display of the pictures up on the big screen, and I'd like you to take a look at those and also have a little chance to talk to each other. So, but please be back at 3:30 so we can start promptly then. Well, now I'd like to resume the program with some memories of Carl's life. And first we have some music to begin the memorial part of the program.
Thank you, Bob. It's really great to see everybody here, family and friends, students, coworkers, colleagues. And many of you may not be aware this is also being taped and recorded. It's going to be up on the web. Figures, right? Because, you know, Dad actually wouldn't have wanted us to be here today talking about him. He wouldn't have wanted us to be sitting in a beautiful hall. It's a great place to learn, a nice quiet thing at the base of a huge ivory tower. He would have liked us to be sitting around a banyan tree, hiking the trails. He would have been hiking with us, maybe a little bit in front, usually. He wouldn't have wanted us to be talking in abstract terms about theory. He would have wanted us to tell stories. And as Dean Sommer said, he would have wanted us to celebrate, because he knew he lived a very rich, full life. It was a life of privilege. He was so privileged with all the experiences and his parents and all the rich heritage. And he was privileged by all of you here in this room, and all of you and out there somewhere in cyberspace or wherever. That global community, that we are just one part of that large web that Carl formed. And that's what he would want us to focus on, is that connection, the relationships. And most of all, he wouldn't have wanted us to talk about him, but really he would have wanted us, and I can hear his voice coming on somewhere back here, to address the really important issues in public health. Now, come on. He would be sitting here. Come on, Henry. Let's go. Let's talk about the really important issues, and let's get over all this other stuff. I mean, it's nice to hear the music. It's a really great setting. But the point of public health is to be action, and he was a man of action all of his life. And there are too many stories to go into about that. But of the many things that it's been a joy to sort of go through, this CaringBridge website that is present, when he was sick with his prostate cancer, we set up this site to sort of inform people what was happening. And there are almost 500 different statements there by people from all around the world talking about his life and what it meant. And again, he would have said it's not their recognition of him, but what was it that he allowed people to do? What was it that he allowed us to do? How do we move forward? And he always had that sense of forward motion. In talking to Dean Sommer about this, he was talking, we were bouting ideas back and forth, as he's good with. And he said, well, he would always listen. You would always see him listening. And he would be learning. Henry Perry, there was the one slide he had to go through fairly quickly, but Dad's listening to Roger Rowley. And if you looked at his expression, he wasn't entirely happy. There was sort of this, he had that little grimace of, He was thinking of what he is going to say. He would wait for the moment. He would listen, but then he would come back. He didn't mind that argument. He didn't mind the controversy. He would push. He would always challenge. He would listen, and he would move us forward. And that was sort of the thrust and the trajectory of his life, was in that. And to me, as well as to all of us who were his students, he always advised us to look for the disagreements, look for the arguments, look for the gaps and the redundancies. He said, if there's controversy, if people are debating horizontal versus vertical, or whether we should do a targeted polio program or build public health infrastructure, he said that debate, where there's good points on both sides, that's the place to focus your energy. Those are the real issues in public health. And particularly if it's a debate happening around how to serve the underserved. So there are several things I've come through as I've gone through his office, and people have been sending things in, or the comments that are going up on the CaringBridge website, that his tremendous passion for those who were in greatest need. He said, actually, and this is part of the dirty little secret about that, is obviously in public health we want to look at the whole population. But if we focus on those who are in greatest need, not only will we make a big difference, but we've vastly simplified our work. So he would go out and listen to them and learn from them and build, and that's what he would challenge us to do. My brother had been much more dramatic in his eulogy at church, but I found Dad's PDA, his 3x5 cards that he would use. And this starts off, it appears to be a talk he gave in an undated year to Delta Omega. And he said, I promised alumni I would share with you 2 personal rules that used to be part of International Health 1. And the students came to call them Taylor's Laws, which apply to all international health work. And I won't read you the whole thing, but the first is that in international negotiations, remember, a proposal is a promise. So I'm making a proposal to you, recognizing it's a promise, that Carl would have wanted us to really focus on how did his life touch us and make us different? How would we move forward? How would we remember him, celebrate his life, but transform ourselves and the world in action directed at those in greatest need? So he goes on and talks about bargaining in the bazaar, as he would. And then he says, great misunderstandings arise from the American procedure of tossing out a possibility and then seeing if agreement can be reached. Now, obviously, he didn't think that was always best. And then the second one is very interesting, and Ann Barassi actually has it in her last slide there. Taylor's second law is you have to be different to make a difference. And he was not, you know, had his pet, and we keep debating it. I think it's scaly anteater, or maybe it's armadillo. You know, we go back and forth. But being different, he wasn't ashamed to be different, but he knew why he was different. So when he was walking up 8 flights of stairs and then deciding, well, I have to get off at the 6th floor and take the elevator, I need to get my knee replaced. When he was doing those things that were different, there was a purpose, there was a clarity of that vision. And that's where we had many late nights where he was trying to help me to be clearer in my vision. But you have to be different to make a difference. Genuine feelings of caring and concern build cross-cultural bridges. Village people especially have acutely sensitive nonverbal radars and can quickly tell what your motives are. So in going, not only does it reduce your problem by at least, your job by at least 4/5 to focus on the world's bottom billion, or whatever you want to call it, the most underserved, but they're the people who are going to be most honest. In dialogue with them, you can direct your attention and figure out what the solutions are. So I better, otherwise Ricky's going to be, where are you, Ricky? Okay. She's got her little cards there, and it's really fantastic to work on putting something like this together. The trick isn't in what we'll say, but what we won't say and how we'll keep our focus. So, and we knew him as a teacher, but this sense that, like any good teacher, he was a learner. And he would listen so that he could learn, and then he would come back and he would teach what he just learned. And Dean Summers said, and then he would be really passionate about the latest learning that he had gotten when he was out in the field. Then he'd go on another trip and he'd come back passionate about that learning. And he kept evolving through his career. The early part of his career, without going through the whole litany again, but the early part was in tropical medicine, tropical disease. That was his passion at Gorgas Hospital, and he really wanted, at one point he was very disappointed that he really wanted to be sent during World War II to the Burma Road to study malaria. Mom wasn't that happy as a newlywed couple, and she was tickled when they got posted he became chief of medicine at the Pittsburgh Marine Hospital, which is close to her family. But he really wanted to go out there. He did tropical disease, continued his work here at Hopkins. He had several NIH grants on leprosy and worked with John Hanks, and really had that focus on tropical disease and was a member of the Tropical Medicine Dinner Club. He kept that up. You couldn't survive here at Hopkins unless you had that type of base. His work then has already been talked about with Nick in medical education, preventive medicine. He grew into the issue of doctors for the villages, but then he realized doctors wouldn't necessarily go to the villages, so let's work with the community health workers. What do the community health workers need? They need to be part of a primary health care system. What is it that makes the system work? It's equity. So that is really the trajectory of his career, and he was always learning and somewhat shifting his point of view as he went forward. One thing that there were many dinners, just a little anecdote about learning, because there were many dinners where Mom was explaining things or a speech, and she would make some bold interpretation of schistosomiasis was clearly happening because of this, and she'd turn to Carl and say, "Isn't that right, Carl?" And he'd go, "Well, Mary, you know, I never learned as much about medicine as when you explain it." Now, as a kid, I always thought that was kind of a put down, you know, sort of like, well, I'm trying not to embarrass you in front of all your friends, but I have no clue why you got to that conclusion. But it was his active listening to her and the teamwork that they had, the sharing. She gave him such a totally different perspective on the world. And to watch the two of them in the pictures that show both of them looking at each other, there was this teamwork. She was an educator. She was working with inner city kids. She was doing a nursery school in India. You know, she was the country girl from central Pennsylvania. He was a villager from India, and they kept that grounding and always played that. It was, needless to say, an unusual household to grow up in. And you know, that's part of where I was reflecting, you know, it's not about me, but there is that lesson, just those of us who have been his students, who have been around him, who have walked the trails, who have done research, who have co-taught with him. They're both giants. It's hard to sort of stand in the shadow of giants, but part of his grace was that he would create that enabling context for us. He would ask the question. So as a 14-year-old, we were going on a hike in the Himalayas. Well, it was an expedition, and it was to Ladakh, and there was always a purpose. We were going to go study. So we had our project, and I was supposed to capture pika, because he had a belief with John Hanks that the ears of pika, they're like rabbits, so they have very long ears. In the Himalayan area, they have a lower temperature on the ears. And he believed that that would be the way we could finally get an animal model for leprosy, was to grow it on the earlobes of pika. But my job was to be the trapper. So he and Mom would always have this sense of what is the learning opportunity, creating those conditions and moving those things forward. And I think that's one of the challenges for us is how do we listen and learn and then move into teaching? How do we convey those same stories in public health? And how do we talk to many different audiences? Again, in their partnership, Mary would set him up for something, and necessity is the mother of invention. So many of you may remember, I think it was called the Maryland Reform School for Boys, right? Which? Oh, it became the Maryland Training School, that's right, a little more politically correct, but still, we all get the idea. So Mary came home one day and said, "Carl, I have to teach out there, and I want you to come teach the boys how to read." And he was like, "You're the reading teacher." She said, No. I want you to bring your tiger skin and your crocodiles and your snakes, and you've talked about what it's like to walk quietly in the jungle and how you listen. And so I want you to teach them how to read the jungle. And so the two of them then collaborated, and he went out there and told hunting stories, but all of his hunting stories had these educational principles of how to read, what to look for, what to listen for, how you created the vocabulary, and he and Mom wouldn't have worried about the theory of it. I got interested in that. But they would have said, it's just stories, and so that sort of dynamic collaboration he always put himself into. So I'm going to skip forward here. Because what I want to really focus on and sort of tie these themes together, what it was like to be with him. And yeah, most of the time it's like, oh, here's Henry, this is Henry Taylor, Carl's son. Or the times I would be, they're giving a talk on India and mom needs to show how do Indian kids dress? Henry, come on up here. I'm an extreme introvert, okay? So they were always setting people up. You all can find in your own lives those stories of how they would push you just to that point of discomfort. But there was always a purpose on that, and the purpose was to be of service. And so growing up in that atmosphere, there was really a sense, I went through a period of time, young adulthood, of really talking to counselors and stuff, as we all do, sort of about workaholism and what's it like to have a workaholic father who doesn't play bridge, doesn't drink beer and watch football games, yeah, he goes, I tried to get him to go canoeing on the Potomac, and he's like, well, sure, let's go canoeing, but wouldn't you rather go take a hike in the Himalayas, So what's it like in that situation? And what was so important was that I came to understand in later years, and in these last 5 years, the privilege of being able to live in the house with him, co-teach with him, talk to him, hear and understand the stories with an adult mind was just such a phenomenal experience. But I came to really appreciate this sense of vocation and that dedication to service that folks have referred to. And I think folks, how do we articulate that? We'd try and get him to define empowerment, right? And he'd say, oh, well, you can't measure it. You'll know it when you see it. So how do we capture that same spirit of service and of dedication that is what makes public health people great? And maybe it's the right arrow. So in thinking about this, Bob Lawrence and other people gave great things, but Albert Schweitzer, I think, said it right. My life is my argument. And I've talked about Dad's life and the way he lived his work and he worked his life. And it wasn't that he was not so, for a long time I thought he was kind of a nerd and didn't have any friends. And then I started going to APHA, and my goodness. And all of you who have come at this point, I mean, Dad had friends. And he had bosom buddies. And he had deep, deep relationships all over the world. And that was his life. And he loved it. And it was also his argument. And I love that twist there of argument, both this issue of confrontative challenge. He was always pushing us and challenging us. But it was also the justification of our lives. And it was a justification for his life. And as we think about how we're going to go forward, we remember his 93 years of energetic living. He was a little disappointed to, he made that class. He was, so January 26, and he was, Martha, some of the students helped us get out of the car, and I want to mention Officer Lewis, who's one of our little security guard guys, who were most of the time he walked by them. But Dad obviously needed some help, and he found a wheelchair when everybody said there is no wheelchair in this building. Okay, he said, no, I know where there's, just stay here, I'll come back. So, and he muttered as he's coming in, he had a walker, he said, I've never seen a walker in this building before. And I was like, Dad, that's okay, we can go if it's too much. He's like, nope, I'm going to teach the class. So he went in and taught, but that sense of there was work to be done, he had that energetic living, he pushed, he kept going forward, always going forward. And he literally typified the ideal of somebody who died with his boots on. Because that was his passion. We knew that if he stopped going to Afghanistan, if he stopped writing articles, if he stopped teaching, he would have curled up and died. Dad wasn't somebody you could put out to pasture. And part of his tremendous legacy to us, to the family, all of us in the room, to the family, and to the school and to Hopkins, is to really remember that sense of service, which I think we have. I'm looking at Ricky and all the folks, Dr. Black, all of the folks, all of us who make Hopkins what it is, that's that aspect of Hopkins that is so important. We really do have that legacy, and that keen witness to the world of a life of service, of the purpose, the direction, that things have meaning. So thank you, because you all give us meaning, and I really appreciate that. And I'll actually do the handoff with Dr. Black now, so that.
Thank you very much, Henry. I'd like to next call on Dr. Edith Schoenrich, who is the director of our part-time professional program, Dean Emeritus, Senior Dean Emeritus, and someone who has, I'm sure, many remembrances of Carl.
And greetings to all of you, family, and to all colleagues. And I just choose that single word, colleagues, because I think it's in the spirit of Carl Taylor and all that he meant to all of us. He never differentiated, really, faculty, students, staff. We were all in this together, all of us somehow, with something inside of us that pulled us together to a sense of common mission. So to colleagues, you've heard some wonderful things about a very wonderful man, and it's hard for me to find any empty spots to fill with comments of my own. So I will just give you one memory, maybe two observations, and then perhaps a final comment. First, the memory. Is Bill Reinke here? Well, oh yes. Well, this memory dates back to the early 1970s. I got my MPH in 71, but my interests at that time were heavily clinical and heavily domestic. Though I had always dreamed as a child of traveling around the world, I just had not been involved in anything at a professional level that was truly international health. But at that time, in the early 70s, I was sitting for the board exams to be certified as a specialist in preventive medicine to add to my internal medicine certification. And this school was one of the locales where that examination was given at this time, which I have in my memory so clearly. And Carl Taylor and Bill Reinke were a team of interviewers who were to examine the candidates face-to-face, orally. In those days, of course, there were no computers to use in these examinations, and so that the written tests were supplemented by oral examinations. Well, as you might expect, I memorized the parts per million of this and the immunization schedules and the distribution of the various disease processes around the country, around the world, really. And I was really ready, just full of facts. When I came before Carl Taylor and Bill Reinke to be interviewed, they didn't ask me any of these things. I thought, what kind of men are these? I memorized all this material, and they don't seem the least bit interested. Carl really asked me very penetrating questions. If you want to bring about a new program in a new area, how do you do that? With whom do you talk? You feel, perhaps, that you know exactly what needs to be done? Are you sure that the people are going to think so too? With whom do you speak? Where is the power structure of this community you want to work with? And I was really puzzled. I did my best. But it was really later that I came to understand what he was really doing. He was testing my own skill to bring about positive, constructive change. And this is the observation that I want to add to all the wonderful things, and every word of which I agree with, that we've heard this afternoon so far. He was teaching me at the same time he was testing me. He wanted to know what my future prospects were to bring about positive, constructive change. And that was one of the things which perhaps hasn't been articulated in quite this way that I think was so very, very important about Carl. It's behind everything that many of the speakers you've heard have already spoken. It was behind that. But he was a man of action, a man who wanted change and who knew how to do it. And everything that Henry said, everything that Dr. Perry said, everything that some of the other speakers have said shows this so vividly. He was sensitive. He wanted to listen, to build trust by listening, and to leave something behind him that was sustainable. And that's what he wanted to know about me. And that's what I've wanted to know about the students that I've interacted with. How successful are they going to be to bring about positive, constructive change and to leave something behind them when they themselves leave the scene? And I think the school is, in the last 10 years perhaps, really begun to make a serious effort to provide this kind of skill, this kind of skill in addition to cognitive knowledge and general principles with our analytic tools. But the other observation that I wanted to make about Carl is that gradually over the years, he became the conscience of the school. And I referred to him that way in talking with many other people. And I told him that many times also, and of course he denied it. But he was the conscience of the school. He was concerned, as Henry said, about the least advantaged persons on the planet and giving priority to their needs. As time has passed, Robert Lawrence and Chris Byrer have assumed this role, and we now have in the school, I think, a growing and outstanding kind of emphasis upon the ethics, the morals that are important, and the importance of having a conscience about what we are doing and not utilizing other people in a disservice kind of way. We've had other giants in our school. George Comstock comes to mind, who had internal mantras, if you will. George carried with him at all times the statement, "Be ashamed to die before you have won some victory for mankind." Of course, he meant womankind, too. But Carl had this kind of inner voice that directed all his activities. And I'll apologize in advance to the Reverend Foster Connor, who will be speaking shortly. I did not get to the opportunity to talk with Carl at any time about whether there was a particular theological base to his altruism, his commitment to the least advantaged among us. I never identified him with any particular theology. I think as the years have passed, I've found some people who are truly unique, who have an inner light of some sort that transcends cultural barriers and cultural differences. And Carl was one of those people. I don't think, really, that it would have mattered whether Carl was born into a Buddhist family, into a Hindu tradition, or a small village in the Amazon forest. I think there was some special light in Carl that did indeed transcend any of our current or past philosophical approaches or theological approaches to our lives and to others. Carl was one of those unique individuals. The final thing, I'll say one more thing about that. I think if he had been born in a small village in the Amazon forest, he might have ended up as the shaman. He would have been the person who was the peacemaker, the conciliatory force, the one who was in touch somehow with all the other forces that we don't yet understand. I think he would have been the shaman. The final thing I will just say has to do with the fact that often when I get home at night, I confess I sit down in a big chair, pick up the remote TV, and cruise through the various channels, partly just to clear my mind and to begin to be able to readjust my perspective on life, and before getting dinner or doing the laundry or doing some of the other things that await a person at home. And a few evenings ago, I chanced upon a program that was a replay of a conference held in another city about a year ago about primary care. There were a panel of speakers, and each one told about some innovative development in primary care that he or she had been involved in, and spoke of ways of trying to provide incentives for professionals to move into that field, and incentives for patients to find medical homes providing care, primary care, and all the kinds of things that in health policy and management and so on we worry about in regard to this phenomenon we call primary care. But one of the speakers ended her presentation with what she said was a proverb, which I can paraphrase. And this was, the people who say it cannot be done should get out of the way of the people who are doing it. And I thought, that's Carl Taylor. That's Carl Taylor. He spent his life and poured his energy. And now the energy of his family who follow him, and all of those students and other persons that he has touched during his life, he poured the energy of himself and all these others into things that some people said could not be done. And he did it, and you all are going to keep on doing it.
Thank you, Rita. Next, I'm going to call on Professor Bill Ranke, a longstanding colleague of Carl's and a member of our department.
I guess I'm the uninterested speaker of the session, but certainly not uninterested with respect to the topic at hand. From what we've heard up here, as well as your own experience, I'm sure that we all agree that Carl was first of all, a leader and a mentor. He was a great colleague and a personal friend. Nothing very unique about that. So my challenge is to try to convey a few things by which I can express my feelings of how unique some of these characteristics were. There was no question about Carl's intellect, about his vision, and yet that came through not in an overbearing or intimidating way in any sense, but rather along with that vision and that leadership, he recognized that in all of us there were certain areas where our knowledge exceeded his in some small area, and he was great to listen to our views in those areas where he could learn, and then to draw out our participation, our contributions to the team effort in those areas. So that was his expression of leadership, mentorship, and collegiality. But then there were those numerous occasions in which he would step aside and truly be interested in listening and listen to personal problems, whether it be a student's financial problems, whether it's a faculty member having difficulties in promotion, whether it's a personal a problem of illness in the family or whatever. He could certainly change course and be just as interested in that as in a highly visionary, intellectual, professional endeavor. Just two concrete examples in my experience to reflect that. One goes back to the Narwhal days, in which every summer, every year, there was a retreat in one of the hill stations in North India, at which all of the staff, that is, some maybe 155, 160 of the Indian staff at all levels, along with 2 or 3 of us from Baltimore and Carl, would gather together to come to understand what the status of the project was, what are the obstacles being faced, and then to establish a vision, a plan for the next year. Again, the leadership and the vision, but everybody involved, the family health workers, the nurses, the doctors, everybody. And in a situation like that, where there were so many people, most of them living in the small village of Narwhal, there were naturally a lot of personal problems that arose. Carl would identify those in the first day or so of this conference, and then he would make arrangements for each morning after that, as long as the conference lasted, to meet with the person who was having difficulty on a before breakfast hike. This was generally, we might be at one of the hill stations at about 7,000 feet, and the hike was always scheduled so that we would climb probably up to 8,000 feet and back down, so that anybody with a problem, it was a genuine problem before he was willing to go on the hike. But many did, and I had the fortune, I guess, of accompanying Carl and these individuals on occasion. And to me, it was remarkable how seriously he would take the problem, what might seem like a mundane problem to others. We would conclude the hike, we would have breakfast, and an hour later we would be hard at work with this, again, visionary exploration of the future in a professional sense. So that was one illustration of the features of Carl's character. The other one that comes to mind is the famous Taylor picnics. Every year, about this time of year, the Taylors invited faculty, staff, students to their place for a picnic. One of the prime features of that picnic was a softball game. Now, those of us who were there year after year, we always looked forward to this picnic and looked forward to the softball game. The students, this was their one and only shot at it for most of them, and they didn't know what to expect, but they certainly did come to take this as a wonderful experience, including the softball game. Somehow Carl was able to get them all to participate enthusiastically. Now, for most of the Indians and Pakistanis, this was their first crack at softball, and they played it as if it were cricket, but nevertheless they enjoyed themselves. And then we had the wonderful dinner prepared by Mary Taylor afterwards, and it was really a team collegial occasion. Now, one other point that I find very useful, and that is that Carl always seemed to focus his attention and devote his time to things that were really important. Just three examples of this from many. First, his formation of the Department of International Health, which at the time he came was quite a unique situation. But he made something out of it. It turned out to be an important endeavor, which continues today stronger than ever with excellent leadership. The second thing, he saw the potential advantage of getting a number of large organizations involved in health work one way or another and bringing them together in the field of international health in the form of a National Council for International Health, formation of that. The usefulness of that has proved to be important, and that has not only survived as a global forum, but also continues with as a strong institution with excellent leadership. The third point to mention is his role, Carl's role at Alma Ata and the Declaration of Alma Ata, focusing on improved coverage of basic health services and equitable health for all. His role in that, of course, was central, and that continues. That area of interest, area of concern, continues to be important to the present day. To sum up then, I think one thing that brings it to a head as far as I'm concerned is that a couple of weeks after Carl's death, I received an email from a medical student in Bangalore, an individual who was a stranger to me, and I'm quite sure was a stranger to Carl. But this individual, medical student, said that he had seen one obituary in the Indian newspapers, but he hadn't seen much made of his life, a celebration of his life other than that obituary. And this medical student was soliciting my help, if I could help, in identifying and locating individuals who had been on the Naringwal team in the past, with whom this fellow could work in getting the message across in a better way. Well, I don't know whether I was able to help him or not, but the point is that this was an example that reassured to me that Carl's legacy was not only in terms of the important things that he associated himself with in his lifetime, but that this legacy continues on in the next generation around the world.
Thank you, Bill. And next, Reverend Andrew Foster Connors of the Brown Memorial Church in Baltimore will give his thoughts about Carl.
Two things I'd like to say by word of introduction. And the first is that not only as pastor of Brown Memorial, but also as clergy co-chair of the BUILD organization, I'm very aware of the School of Public Health and of the many community partnerships that you all participate in. As I heard Henry speaking earlier, he inspired me to deviate a bit and say directly that I think Carl really appreciated those kinds of partnerships between institutions in our city and our civic institutions and churches and mosques and synagogues and other places of worship. So keep up that good work. Secondly, you will notice if you look on your program that my name sticks out like a sore thumb with the MDs and the MPHs. So I realize it's a bit of an aberration for a reverend to be speaking at the School of Public Health. And I would ask simply, I'll tell you the same thing that I tell people of other faiths who come to Brown Memorial or people of no faith. If I say something that doesn't make sense, just use your literary imagination and we'll all be all right. I think I was invited here today to speak a little bit about how Carl's faith informed his life and his life's work. Carl Taylor joined Brown Memorial Park Avenue Church along with Mary in 1963. He and Mary knew that Brown Memorial was his church, their church, when the pastor at the time was arrested with other Christian and Jewish clergy for integrating Baltimore's then Gwynn Oaks Park. Carl saw his Christian faith not as a purely private affair, but as the engine behind his life and work, driving him to seek social justice in a world badly broken by division, economic injustice, and growing religious fracture. His faith was the foundation for his vision of community empowerment, built on the conviction that the institutional powers of governments, public and private institutions, including academic institutions, have a moral responsibility to respond to human need. And further, that human beings, when given the tools to organize themselves, are best able to create just and lasting change in their own communities. I think that Carl's success in his community transformation work was partly due to his ethic of welcome that allowed him to receive human beings in the totality of their lives, to really listen to their struggles, their hopes, their dreams, and their motivations, and not just the parts of them that fit snugly with his own preconceptions, be they academic or religious. I know that some of you probably benefited personally from that ancient religious practice of hospitality that found a contemporary home in Carl's life. He listened intently because, as a follower of Jesus, in whom we Christians see God's presence and purpose, divine wisdom or divine presence might be manifest in anyone at any time. In this growing world of pluralism where religion seems to fuel so much in the way of hatred and war and instability, I am increasingly convinced that Carl Taylor had much to teach us, both in the church and in academia. It seems to me that he was not intimidated by religious difference or any other kind of difference, as has already been made clear, but curious about it. He sought to understand those differences as an essential aspect of human life rather than the single area of life that academia must keep locked in the closet. Religion was not something to be feared, but something to be understood, valued, and broadened by encounters with people of other faiths or of no faith. This openness was, in his view, the foundation for peace, a peace that I know he prayed for not just with his words, but with each and every day of his life. May we continue to learn from his work and the argument that was his life. Thank you.
Well, now, as I think quite appropriate, we're going to hear from Carl. He gets the last word, so we have some parting thoughts. So if we could run the tape.
One of the greatest things about the way in which Hopkins has functioned during these years has been this sense of realism. People who have been in the leadership position here knew what was real around the world, and they knew that we needed to take pioneering approaches, and they weren't afraid to really try to see what might work. And that's what research is all about, getting a good idea and then going out to test it under conditions first that you can define the idea as a purely scientific issue in which you are able now to test realistic hypotheses and see what works scientifically and what does not work. And now, as I see that happening at the present time as Hopkins, I do feel that we have a particular opportunity now to go back to what I've been talking about all these years, which is the community-based approach, because we have gotten away from a lot of the community-based thinking. And I think we have an opportunity now to get real about what's going to really make a difference with all of the successes that we have with our technology. How do we actually make that work in real life for people and their families around the world? And so I think that that challenge is just wonderful. I told the students that I think they're lucky to be coming into it at this stage, that they can really make a difference with their lives.
Well, I think no one could have said it better. although many of the speakers also had very moving and thoughtful comments about Carl's work and his life. So I'd like to thank all of the speakers. I'd like to invite all of the participants here to join us out in the gallery for the reception. I think we have many more thoughts to share. There are many here, I think, who could have told just as interesting and moving stories, and I think we can all go out and enjoy them in our private discussion. So thank you all for coming.